Okay, it's 1 minute after. I want to thank everybody for joining us again on this virtual town hall. Let's see here. And, with repetition, it's human nature to kind of gloss over it and have it not impact you as much. But every week, I just want to truly thank Terry at the LFA Georgia chapter for all the support and what she does for not only this virtual town hall, but for everything that deals with lupus in our state and has been doing so for a long time prior to the pandemic and will be for a lot longer, Lord willing, afterwards. Also want to thank the Georgia Council on Lupus Education and Awareness with Chris Reed and Representative Kim Schofield, and also the GOAL research cohort out of Emory University. So we don't have a whole lot this week that's terribly new, so I'll give a general COVID update as I have done, and we have 2 questions to address. So globally, we are reaching nearly 7.6 million cases and 424,000 deaths. And in the US, we are almost at 2.1 million of those 7.6 million infections with 116,000 deaths. And as I mentioned in the weeks leading up to this, Brazil has had an amazing trajectory for all the wrong reasons. They are really rocketing up there in terms of the numbers. And so they are solidly in number 2 now. And with their trajectory, they are really going to give us a run for our money if they don't do some drastic measures. 40% of all deaths are in Latin America and in the Caribbean. So here's a map of where the cases are rising the fastest. And you can see the dark and red and the orange colors are the ones that are rising the fastest. And you can see Mexico and a big chunk of South America. And then you can see a lot of spots throughout Africa, continuing in Eastern Europe and into the Middle East, as well as India. Here are the hotspots in the United States. And again, if you just kind of let the colors hit you, you certainly see some cases that remain, some areas that are hot in the Seattle, Pacific Northwest region and in California. But again, what continues to be so striking and hitting home for all of us here in Georgia is the tremendous amount of rapid and rising cases throughout the Southeast. And so that is something that we're going to have to grapple with for quite some time now. And along those lines, we talked about, and I'm sorry this isn't very clear or sharp, but we talked about some of the health disparities issues with this. And you can see here on the left that these are the top counties with the highest infection rates. And there's Truesdale County in Tennessee that has a really high rate for some reason. And then, it's smattering throughout the different regions, again, a lot in the Southeast, but also in the Midwest. Really, when you're talking about Georgia, there's only one county that kind of hits the radar in this category. But when you talk about the top 20 counties with the highest death rates, you have already in the first 3 out of the 4 counties being right here in Georgia. And then you have another one in Georgia down here. So you have, actually, you have all 4 of the top counties, I'm sorry. And then the 5th one down here. So 5 out of the top 20 counties in terms of the death rates are in Georgia. So again, you can see that the purple lines represent African-American rates, and with our region having high numbers of a lot of minority groups, but especially African Americans, and the risk factors associated with that, and the comorbidities, you're talking about a very disproportionate burden of one of the more severe outcomes, and that obviously is the death. So it's not just infection, but it's really outcomes from infection that we are concerned about. So when we talk about Georgia now, more specifically, we are now in an interesting category. We are solidly in the category of where cases are increasing. And this just got converted in the last day or two within at least the New York Times database. We were for a while in the stable category, and all signals are pointing along with the rest of our neighbors. So it really shouldn't be too much of a surprise that we're starting to see more cases in Georgia. This is specific to the metropolitan Atlanta area with regards to the top line, meaning positive cases for COVID, and the bottom line is positive COVID cases in the ICU. I'm sorry, the top line is positive cases of COVID in the hospital, not in the ICU, and the bottom line are the positive cases in the ICU. And way back in March, we're talking about that big rise and the stay-at-home orders to trying to kind of mitigate the flood into the healthcare system, and that worked, along with social distancing and masking got implemented, and cases came down, and now everything is starting to reopen again. And here you kind of see a flattening of the ICU numbers. I mean, that's good in the sense of it's not going up yet, but on the other hand, it's not going down. And what you can see is, in terms of positive cases in the hospital in general, that you're starting to see an inflection point where it's heading up. You know about the stay at home, shelter-in-place orders from the governor, and over time it's been repealed. And up until this weekend or Friday, the only really layer of orders were primarily in terms of the older individuals and some specific activities. But basically, as of Friday, the governor has repealed everything. The shelter-in-place order for those 65 and older is repealed unless they have underlying medical conditions. But basically, there's no limits on the number of dine-in customers at restaurants. Conventions can resume. There's reopening of live performance venues, while still recommending social distancing, face coverings while outside, and sanitation practices in accordance with CDC. And there's some recommendations for schools, summer camps, restaurants, sporting events, live performances, and other activities. And you can find that all in this website here in the bottom right. But as I said before, these are governmental orders designed in part to help minimize the impact of the infection on the public's health, but it's also balancing and taking into account financial and economic impact. And mixed in with all of that are this very broad, political headwinds. So regardless of what the government is saying, as I mentioned, the virus is still out there. It's contagious. It's not going anywhere, and people with lupus are still at risk, in the higher risk category, in terms of some of the poor outcomes with COVID, being immunosuppressed. So you need to continue to practice all the safe measures of social distancing, face coverings, and sanitation practices, and being very prudent as to where you choose to go, acknowledging that places are opening now, but that doesn't mean that you need to be less relaxed. It doesn't mean that you shouldn't go to any place that isn't open, but when you do, just really take into account how badly you need to go. And if you choose that you need to go, you shouldn't do that with too much regret, but be cautious, controlling as much as you can control. You can't control the people around you necessarily, but you can get an idea of the people around you. And certainly you do have control over these things, the social distancing that you are able to implement, moving your body around in certain spaces so that you're physically away, covering your face, and the sanitation practices. So talking a little bit more about Georgia, this is a case study of Florida that may be relevant to what may happen in Georgia. Up here, let's start in the top left. This is time from May when Florida began its reopening. And much like Georgia, things have been fairly stable for a few weeks. And so more people became relaxed and beaches opened up and there was even more opening. And what they're seeing now is a dramatic increase in number of cases. And you can see here that deaths, which on the bottom left, tend to lag behind infections. But here you can see that there's already sort of a spike and a new kind of leveling, a higher leveling of the number of deaths. The total percentage of positive cases, it doesn't change as dramatically because that's influenced by the number of tests being given, and because you get more and more people who are negative if you test a lot of people. And so that has an influence in terms of keeping this line stable. Here, hospitalizations, you can get a sense that's generally going down, but again, the worrisome kind of little upward rise here to the current date, coupled with the death rate here and the positive numbers that are going up. It really paints a picture that Florida is starting to hit another up peak. And we're just going to have to wait and see as to how great that becomes and what impact it has on the healthcare systems there. One more example before we go into the questions, and that's of Houston. And the number of cases in the Houston area has gone up so much so that local authorities are actually considering whether to implement another round of stay-at-home orders. I don't know to what extent they're going to shut down businesses, what caveats there will be. And this hasn't been implemented yet, but just even having a discussion in certain parts of the country of going backwards and re-implementing various restrictions gives you a sense that, or a reminder anyway, and something that you should be telling the people around you, that we are definitely not out of the woods. All right, so first set of comments and questions. Is it really necessary to wear a face mask while out in public? There's conflicting information about wearing a face mask. Even a physician has stated wearing a face mask is like using a chain link fence to protect against mosquitoes. Some stores require their employees to wear a face mask. Not every patron wears a face mask. When wearing the face mask, some people do not cover their nose and mouth. Some wear the mask on their chin. Good questions. Is it really necessary to wear a face mask while out in public? And how effective is that? Is it really like using a chain link fence to protect against mosquitoes? I mean, the analogy of a chain link fence to protect against mosquitoes, gives people a sense that there's basically no effect of that. And that clearly is not the case. It is not a solid steel wall where there is 100% barrier to the mosquitoes, but if you think about how this virus works and how we transmit it, having a barrier as a face mask makes absolute sense. And it has been proven without a shadow of a doubt that it decreases transmission. Remember, this virus is a respiratory virus, meaning that it lives and replicates and then gets transmitted to other people primarily through the respiratory system, which basically starts from the tip of your nose, back to your throat, your mouth, and especially into your lungs. That is where it loves to breed. And it has been designed to infect people in those areas and be transmitted that way through cough and breathing. So these droplets, these respiratory droplets that we all emit out into the air, even as we speak, and you don't realize that, and it may sound gross to some people, but we're constantly throwing out little particles when we speak. And when we do that, these little droplets come out, and they are really small. They're about at least 1/10 or 1/50th the size of the width of a hair. So they're extremely small, and you can understand how easy it would be for these droplets to go into the air and then go into someone's nose and into their mouth or into their lungs as they breathe in those droplets. Now, a sneeze is much more significant than just speaking, obviously, or a cough, when you actually forcibly exhale. So these are all sort of factors. It's not as if you're just around somebody with the virus, they talk, and you get sick. You have to think about, how is this virus getting from someone who is infectious and into you in the areas of the nose, the mouth, possibly the eyes, or somewhat the eyes, and especially into your lungs. And when you're talking, or even having a cough or a big sneeze, just having something around your mouth and your nose as you talk is going to capture a lot of those respiratory droplets. I mean, you can imagine when you sneeze into a tissue or into your hand, you can see all that would have otherwise been in the air. So a physical barrier, although not perfect, and no one is saying that the cloth masks and the other ones that you purchase that are available to the public is completely protective of transmitting the virus. But any physical barrier would be a huge way to reduce the burden of viral droplets that gets transmitted to the air from someone who's infectious from their respiratory system. I mean, that you don't have to be a rocket scientist to understand that. Again, it's not perfect, but that is the main way, from a person's mouth into the air, into another person's mouth or nose. That's how most people get infected with the virus. So having a physical barrier around yourself, if you were to be infectious and perhaps not even know that you're infectious. I made a comment before, you might have read, these face masks really protect other people more than yourself. So if everybody wore a face mask, you would really protect yourself. But what you're trying to do is keep all of your respiratory droplets to yourself. But on the other hand, less effective, but still somewhat effective, is if somebody around you is not wearing a mask and they happen to be infectious and they're sending out respiratory droplets. Having a face mask, although there are a lot of areas around it and going through the cloth itself, these viruses are extremely small, but having a physical barrier that would slow it down, allow crosswinds to kind of wipe it off, it makes absolute logical sense that having that there would decrease the chance of, or the number of these viral droplets from getting into your system. So even though most of the benefit of a mask is to protect others, having any barrier between you and another person who's infected will help, even if it's just on yourself. And so then you can imagine having both parties in a room. If there were only two people in a room, if both people had a mask on, it just increases the chance the virus would be able to freely get past the initial mask into the air, cross the other mask, and into the body of the other person. And then also keep in mind that there are a lot of other factors too. One single virus usually isn't going to be enough to infect somebody. It takes a lot. Now, granted, just a small drop of somebody's respiratory droplet contains thousands, if not millions, of viral particles. The point is, when one single virus lands on the inside of your nose, it may not be able to penetrate into your body, just that single one. By chance, it may get onto a hair in your nose and not kind of clamp down. It may be part of the skin where there's really small hairs all lined throughout your body in your respiratory tract that's constantly sort of pushing mucus up and down. And it's an amazing self-defense mechanism. There's the layer of mucus itself that the virus needs to get through. So the more viral particles that get into your system, the greater the chance that it will find one or some of them will break through one of those barriers and get underneath the skin into the blood, into the immune system, and take home at that point. So again, having the mask reduces the burden or the total number of virus particles that may eventually get into you. And then there are a lot of other factors too. Even if you're wearing masks on both sides, with these virus particles being so small, it just takes barely a little breeze for a virus particle to be affected and move in a completely different direction. So if you're in a gym, for instance, and there's relatively little movement of air, or if there is a lot of air conditioning going on without good circulation and it's just pushing that air in a confined space around, I mean, that's going to be a higher risk situation than if you're outside. And yes, when you're running next to somebody and they're breathing really hard, there may be more virus particles being thrown out if they're infectious, but you're in a wide open space with winds going in all different directions and infinite amount of directions it could go, and it gets dispersed so easily that a chance for a large number of viruses getting into your system in an unconfined space like being outdoors is very small. So it's a long way for me to say that having a physical barrier is key. And I'm not sure what this physician said exactly, but maybe the point is that it's not perfect, but it is one of the more effective ways of limiting the burden of viral particles that your respiratory system may throw out or be exposed to for the reasons that I went through. So I think it's very important. And it's too bad that when you try to do well and you wear a face mask, really to protect other people more than yourself, and then you see other people around you not wearing a face mask, then it's a bit frustrating, and we talked about all the issues around face masks, that it's become political now. And in a way, I can understand for some people who don't have the concerns of being immunosuppressed, who may not know people who have gotten sick, who are not in the medical profession or know somebody in the medical profession, to hear the stories of what COVID can do, and to be confined and restricted and not have that freedom of movement, and maybe they don't have much health literacy or literacy in general. It must be very strange to do that. It makes so much sense for us, but I can see a lot of people who are just tired of that, and being at home and having their livelihoods taken away. And so having the symbol of being restrained on them psychologically may be an issue. But I think where we fall short is, um, we don't have good education programs to help people understand. Uh, we don't have unity in terms of our country and our government to be able to present a clear picture and really help people um, do this together. And that's what we really need. Is we need effective measures as one country, and we're having difficulty being one country right now. But I have every optimism in the world that this pain in multiple dimensions, as we all know, that we're going through as a country, will help unite us in the long run. And we're wearing the face mask. Some people don't even cover their nose, and they wear it on their chin. That's so frustrating for me. And I have so many patients who come in, and I know they must be really tired of wearing the mask. And I don't know whether they just allowed or subconsciously they don't see it, but so many times I asked people to lift up their mask over their nose because it just ends up there. And I do see a lot of people in public not covering their nose or just having it come down to their chin. Governor Cuomo in New York, I don't know if any of you saw this video recently, but he was chastising people in the public who were doing that this is a face mask, not a chin guard, and kind of in his tone, and just really sort of chastising people. I thought that was really good. Okay, I'll get to some of the chat questions in a second. The last question is, why is the media saying that COVID can be asymptomatic? How can homeostasis be off in the body and a virus is replicating, but the person will not show signs of illness? I thought that fever was the first sign of infection. Please explain. So one example, and I got this question just a few minutes ago, so this is just off the top of my head, but one example that first came to me is, I'm sure a lot of us have been in a situation where you were living with some people or your family in physically near each other for a period of time, and all of you get sort of sick at once, or very close to one another. Maybe one person gets sick clearly first, and then very soon after that, the others get sick with the cold. The person that was initially sick was infectious with the cold and gave it to the other people, who then became infectious. But you go through a period where you have the virus in you, and you can be infectious with other people, but you're just not yet having the symptoms. And so that's what it's meant to be, asymptomatic with COVID, but infectious. And that's one of the amazing ways that this virus came to be. And that's one of its secret sauce in terms of spreading from one person to the other, in that there is a relatively long period of being without symptoms, but being infectious at the same time. So people go for at least 2 to 14 days, which is why people are told to isolate themselves for 14 days um, if they think they've been exposed to somebody with COVID, um, before they're absolutely sure that they're not infected, because of this very long period of a relatively long period of time um, where people are asymptomatic. So when you say the fever was the first sign of infection, that's not true. It can be one of the earlier. It's one of the earliest signs that you can detect that you're infected, but you clearly are infectious without symptoms for days prior to that first symptom, whether it's a fever or a sore throat or cough or loss of taste or smell. So I hope that's helpful. And this is how viruses work in general. And think of sexually transmitted diseases as well. I mean, why does herpes and um, syphilis and you name it get transmitted? Because people just don't feel it easily at early on. They're clearly infectious, but they don't have symptoms, and that's how the virus really transmits. So yes, please wear a face mask. Alcohol should be at least 60% in order to be effective against bacteria and viruses, especially the coronavirus. It doesn't mean 100% is better. In fact, the sweet spot is between 60 and 70 or so percent, that actually having pure 100% alcohol is not as effective. It evaporates, number one, really quickly. It doesn't stay on to kill the virus as long. And I think there are other reasons that I'm not as expert on, but I do know that 60 is what is generally recommended, and 60 to 70-ish is more than fine. So the question that I just had that I was answering is, what grade alcohol should I use to ward off germs, bacteria, and viruses? Okay, so that's really it. Thank you all. We are going to take a break next Sunday. It's Father's Day. There seems to be a general slowing down of news. And we will definitely reconvene 2 Sundays from now. So just read the announcements that comes out from Terry carefully. We'll give you all the details for the next one. Please continue to send questions. If it does seem like things are relatively slow enough in terms of questions and other general news, we may end up stretching it out a little bit more or continue it every other week, or we may fill in the weeks in between with other topics or speakers. So unless you all give us any more guidance, we may just decide something that you're not too happy with. So this is just more pleas for you to continue to go to the lupusga.org website, take advantage of the resources, but keep sending questions or comments. If you are fine with going with every other week, or you think we should just even do it less than that, or you don't even need to hear from me anymore, please, if you don't let us know, we don't know how to best help you. So thank you again for the early Father's Day wishes. Be safe. Try to enjoy what God's given us each and every day. And I'm very thankful for the fellowship and the friendship of all of you out there in all the weeks that we've been together. And as I said, we'll continue to get through this together. So enjoy the food in the restaurants, but I prefer you do it as takeout. They really need the help too, though. Thank you.